Hi, everybody. Welcome to this edition's Uncommon Ground podcast with myself, Jonathan Silva, and Louie Free. Today, we are interviewing Dr. Kanfer out of Pasadena, California.
Ladies and gentlemen, a really late Louie Free radio show, Brain Food from the Heartland. Late for us.
Late for us.
It's 10 after 6, and I do a morning show, Doc. So, and I am delighted and thrilled, as always, and honored to have Jonathan Silva, a rabbit savior. And I'm an old guy, so I have those old characteristics, Doc. And if you don't mind, we're going to start with you. And if you would introduce yourself, please.
Okay. So my name is Sari Kanfer, and I am a veterinarian in Pasadena, California.
A little bit more?
Well,
I've got questions. Lots of them.
Okay. So I can tell you about myself, I guess. So I'm originally from New York City, but I really just not a city girl. So I moved out to a more suburban area, and I just love California. And in vet school, or actually before vet school, I got my first rabbit, and I was hooked. And I just fell in love with them. I love their behavior, their personality, but I also was fascinated by their physiology, especially their gut and their teeth.
Wow. When I was reading your bio, I saw that about became hooked on rabbits and followed your addiction to the West Coast. I love that. And a special bond with rabbits. What do you think it is? And I know I've read Jonathan's bio, and I love that. And I don't have my ears on.
Louie's a rabbit man.
I'm a rabbit man. I've got lots of rabbits. I have lots of rescues and lots of ears in the studio. So what do you think it is, that special bond?
I think the rabbit personality just kind of complements mine, and I like animals that are just kind of chill and relaxed, but that you have to watch them closely, and then their personality will shine. So they're a little bit more subtle, as opposed to maybe a dog is all up in your face. I mean, I love dogs, but I love rabbits more. So
I agree 100% with you on that one.
Yeah. So, and I just got attached to rabbits. I mean, and I've had friends over the years who are ferret people and pig people and guinea pig people and rabbit people, and really all the rabbit people have kind of been my kind of people. And I've really felt a kinship. Yeah. So, it's just something about them that I love it. So I used to have a pet dog. I've had a lizard. I've had birds. Right now, I've only got rabbits, and have had only rabbits for a very long time.
How many rabbits do you have at home?
Yeah.
I have seven.
Seven? Wow.
Yeah. So my maximum was 13. And the problem was I had taken in a lot of the rabbits that had chronic dental issues, and so managed them for their life. And then they all got old, and then they had chronic kidney disease or chronic cancer. And so at one point I had 5 geriatric rabbits that needed chronic medications and expressing bladders and physical therapy. I got a little burned out. So now I'm trying to have more healthy rabbits to enjoy, as opposed to spending all my time being a bunny nurse. So all my spare time.
But it's wonderful that you devoted yourself to those rabbits in need.
Yes.
Yeah. Because I couldn't bear the thought of like a 2-year-old rabbit with dental disease, and the owner couldn't afford the surgery. I was going to put it to sleep. I'm like, well, if it just gets the proper care, it's going to live out a good, long, happy life. So
that's right. And the cost. Again, I'm jumping all around. Jonathan, I hope you're cool with that. And Dr. Kanfer, I hope you're cool with that. But when I think about one of the rabbits that we had that had to have half of her jaw removed, and the cost. And I know people thought it's outrageous that we were doing that. And it's like my child. And I know people always get a funny, weird about I can't remember how much it was. It was a few $1,000s, couple thousand, and this was years ago. But she lived out I'm going to get teary-eyed, such a wonderful life, and I'm so grateful for the wonderful veterinarian that did this surgery. And she said, again, things I'm sure have changed and advanced, but at the time, I can't remember what percentage she said could be successful, but it wasn't a very high percentage, like 25%. And it was amazing. I'm sorry, I'm going on and on about that.
Yeah, I mean, and you know, rabbit dental disease is my special interest, and I have got a lot of advanced training. And you know, I've been practicing for 22 years, and
Wow.
you know, been doing rabbit dentals and dental abscesses and nasal abscesses for 22 years. And so, you know, I'm very skilled and very experienced, and I do a lot of really complex surgeries that and I definitely am very much more aggressive in terms of I go for a cure and do a lot of extractions. And so I think that there's a lot of different levels of experience out there. And then you know, I pretty much I'm always going to have a good prognosis in my cases. Now it may take several surgeries to get there. Um, but yeah, we usually get really good results from in most cases. So yes, it can be expensive. I think that what rabbit owners need to realize is that you get what you pay for. And you know, if you don't want to pay a lot of money, you're not going to get the top notch care. And you know, there's a lot of really good exotic vets that are going to offer that the highest level care, the best veterinary medicine can possibly offer. And then you're going to have a much better chance of your animal surviving and, you know, the problem getting fixed, whether it's teeth or whether it's a twisted liver lobe or a bloat situation. And so, so there's a lot of different levels of care, but that there are some places, especially when you have a practice that's 100% exotics, they're pretty much always going to be able to offer, you know, top-notch care.
I had a question. How long did you go to school for?
Well, there's undergraduate and then veterinary school. So undergrad is usually a 4-year degree, and then vet school is 4-year in the U.S.
Gotcha. Okay, because we had Molly Gleason on, and she was telling me she went through that plus just hundreds of thousands of dollars in school debt and this and that.
Yep.
I was like, wow.
Oh yeah, I'm never gonna. My debt is never gonna be gone. I'm gonna just basically. I can't even. You know, people might think, oh, you're charging so much money, you must be rich.
That
I mean,
kills me.
no. I basically just bought a house last year, barely, and I still need to have a roommate. So, and I have an old car, and I'm paying the bare minimum on my loans, and I'll just be paying until I die.
Yeah.
So, yeah, the loans are insane.
So obviously you're
my passion, so I couldn't think of doing anything else.
No, I mean, because like I said, I'm so happy to have you on this show, because when people say, oh, rabbit study vet, you mentioned Dr. Kanfer, you know Kanfer, you are I guarantee there's a lot of listeners and viewers right now, and when you speak, people listen. So I'm super stoked.
Oh, that's good. That's good. Yeah. Thank you. I mean, and as I said, I mean, I adore rabbits, and, you know, and I always want to kind of, you know, spread the word and help people take good care of their rabbits.
Yeah.
Certainly, I think when it comes to like an online presence, you know, and you know, I'm on Facebook, I'm, you know, on a lot of those groups, and, you know, sometimes I just don't get involved because.
What's your take on the groups? Give me your opinion, because I have my opinion, but.
I think that, I mean, I think there's some cases where they might not get the best information, but they, you know, if somebody asks a question about like, oh, how should I set up my rabbit's environment, their rabbit's pen? And there's going to be like 50 responses, and most of them are going to be really good, but then there's going to be a couple that aren't. I think ultimately what occurred before Facebook is websites. And the House Rabbit Society has been around for 30 plus years. I mean, even when I was in vet school and undergrad, I was, you know, hearing about House Rabbit Society, and they're national. They have a fantastic website. There's a lot of other rescue groups that also have great information on their websites. I'm always going to defer to a good, you know, reputable rescue group. Now, there are some rescue groups that are, maybe they haven't been around as long, and maybe they're not going to be doing as good of a job, you know, maybe not as specific. I mean, I've heard of a rescue group in this area who's not recommending vaccinations. Another rescue group that when they groom rabbits, they're like making them bald. I mean, so yeah, there's certainly rescue groups where you're just kind of like, eesh, but so I think, you know, definitely House Rabbit Society is amazing. And they have chapters in most of the states. And so when it comes to getting information and proper data, I think, going online to their website is going to be the
Yeah,
most
absolutely.
informative. Yeah. And there are, a lot of really good, knowledgeable vets as well, but there's still going to be a lot of differences,
A lot.
in terms of, what they're going to require for feeding, what their recommendations are. So the other thing I've learned is that there's more than one way to skin a cat. And so
That's sure.
just because I always have a litter box with hay in it and that's how I was taught by House Rabbit Society, doesn't mean, it's wrong to have a litter box that doesn't have hay in it, but you should have a lot of hay for the rabbit. That's
Absolutely.
the most important thing. I mean, personally, I feel like they like to kind of stand in the hay and dig in it. And I feel like it's really good for them that way and enriching, because, and what's natural for them is to be grazing and kind of walking through the grass. And so,
yeah.
But it's very big online on Facebook pages where people are using graded litter boxes and then having a hay bag. And I think sometimes they just are not able to get as much hay.
Enough hay.
Does it mean that that's wrong to do? No. I mean, I just think, and I've got my personal preference for that type of thing.
Yes.
So, but yeah, and then there's other things where, people are maybe giving out misinformation. So that definitely does happen as well.
That's the thing I worry about, because I go on Instagram and see these people that are offering help, which is awesome. I love it. But when you're not a vet and you're just in the community for quite some years, they think they know a lot, which they probably do. But I just think it's just a fine line between talk to a vet, not just a stranger on Facebook or Instagram.
Right.
That's the thing where it just,
right.
I question.
Yeah. But also talk to a vet who's rabbit experienced and rabbit savvy, because, and that, if you, and I think that can be tricky for some clients, because they'll call up a vet and say, hey, do you see rabbits? Oh yeah, we see them.
But
meanwhile, they're seeing maybe one rabbit a week or one rabbit a day, and they're seeing mostly dogs and cats.
Correct.
Whereas if you go to an all exotics practice, they're seeing hundreds and hundreds of rabbits, each month and several each day. And so the experience level is going to be much higher. And so, not to say that there's not really good exotic vets that are at dog and cat practices. That happens. I mean, before I opened my practice in 2010, that was me. I was the only exotics doctor at a dog and cat practice. So, but I think, it's just, if you're not sure who to use, then looking online, whenever I'm recommending or trying to refer somebody to a vet in another state where I'm not familiar with the vets, is I will look on the House Rabbit Society website, because they have a vet list in most of the states. And if they don't have a chapter in that area, then just looking up like rabbit rescue in that state, and then go to the rescue's website and see what vets they recommend. But they're going to not necessarily say like, this is the number one vet, this is the number two. They're just going to list all of them that feed rabbits. And so then what you need to do is look at each individual website for those vets. And if they see all exotics, okay, high quality. If they're not 100% exotics, go on the bios for those doctors. And if in their bio they've got rabbits, they talk about how much they are, how much they've learned about exotics and treating exotics, then that's going to be, another option. So just to kind of try to be able to look up, a good exotic vet in that respect.
That's good information. Thank you.
Yeah, really good information. Again, when I talk to people that I know that have a rabbit and they're not real or rabbit savvy, if you will, Doc, they'll say, the vet that took care of our dogs or cats or whatever. And I always say, you wouldn't go to if you had a heart problem, you wouldn't go to an ear doctor. You go to a specialist if you care enough. And again, you can get advice. I remember when we had the rabbit that had half her jaw removed, a local vet that I know well, who had probably practiced at that time, I don't know, maybe 20, 30 years. He said, I wouldn't even attempt something like that about removing, because he doesn't have he's a great vet, but he doesn't have the experience in that.
Right. Yeah. And then I think that's real important for veterinarians, is to know your limitations. and to be able to make referrals. And I think that a lot of vets don't necessarily do that. They just are like, oh, you should put it to sleep, or, oh, it's a really poor prognosis, you shouldn't even do it. And they're just assuming what the owner will and won't do.
Yeah.
And, yeah. So
What would you say is the greatest misinformation out there, or it's one of them? Obviously not the top, but you were talking about hay, and with your expertise, I would think people would say, well, look, if Dr. Kanfer is doing it that way, that obviously is
that way.
Well, right. Yeah, it's the right way to do it because of your experience and expertise. But what is some of the other?
I guess misinformation would be pineapple juice as being a cure for hairballs.
Yeah.
No, it's not.
Thank you.
Yes, thank you very
what
much.
happens is if your rabbit is sick and stops eating, and you give it some pineapple juice and it starts eating again in a few hours, A, you're lucky. B, you gave it a liquid with a little bit of sugar in it, and that was all that it helped. The pineapple doesn't do anything. Basically, when rabbits stop eating, it can be just a basic stasis, and it's not a big deal, and they'll get better. Or it could be a little chunk of hair that has moved from the stomach and gotten stuck in the beginning of their small intestine. Or it could be something else, like their liver lobe is twisted, or maybe they've got a bladder infection or a bladder stone and they stopped eating because of that. Or you looked at them funny, or you were going out of town and they saw the luggage that you were packing the luggage, or you took them boarding, they were groomed, or anything can cause them to stop eating. But one thing the message I want to get out there is that when your rabbit stops eating, an exam by an experienced vet is so important. B, diagnostics. And sadly, veterinarians are not necessarily recommending diagnostics. That means x-rays and sometimes blood work. Because I've had rabbits who, they look stable and their stomach felt like it was a normal size. It did not feel distended. And we did x-rays, and yet it was actually a bloat. Or we discovered that it was a twisted liver lobe and that they were bleeding into their belly and needed emergency surgery. So, it sometimes it's hard, because if it's, Sunday at 9 p.m., I mean, what are your options?
Yeah.
But, if, in general, the ideal thing is to push for x-rays, push for blood work. Sometimes your vet that you're seeing is not good at reading them, or they don't have enough experienced technicians to get the blood work or x-rays. And so, and sometimes you just don't have an excellent vet in your area. But in general, I think that our rule here, and we see huge numbers of rabbits. I mean, I'm seeing like 10 rabbits a day, every day. My schedule is rabbit, guinea pig, rabbit, chinchilla. That's my schedule. We have 5 other vets here, and they also see lots and lots of rabbits. And our protocol is, if the rabbit or other exotics not eating, we want to get some x-rays and ideally some blood work. And sometimes we say, oh, phew, it's all normal, we're good, it's just a basic stasis. But because we find problems where we can actually fix them and save the animal's life. And we're just a lot more proactive about that. So in terms of what else I would want, that's a misinformation, would be diets in terms of greens. A lot of people freak out like, oh my God, this pellet is better than that pellet, or, oh my God, I can't give kale, I can't give spinach. In general, yes, the thinking is to keep the higher calcium vegetables to a minimum.
Like
the
kale.
thing is that, right, like kale and spinach and things like that, and to use a non-alfalfa based pellets for when you're dealing with a healthy adult middle-aged rabbit. But I think people sometimes get a little too specific about how much they're feeding and what they're feeding, because the ideal thing is your rabbit's diet should be primarily hay, like 80 to 90% hay. So if they're getting maybe like a teaspoon or like an eighth of a cup of pellets a day, that's a really small amount. So whether it's a store-bought brand that's Timothy based, or whether it's, a brand name, I'm not as concerned about that. Now, do I use one of those brand names? Absolutely. I'm always going to recommend the higher quality ones, but I don't get too bent out of shape if somebody's using, just an over the counter Timothy based pellet, as long as they're doing it in a limited amount. And
Makes
then
sense.
greens, kale has gotten a bad rap for a long time, but interestingly, parsley has a little bit more calcium in it than kale.
Wow, I didn't know that.
So yeah,
So they do.
yep.
Wow.
Now, what do? I just feed small amounts of parsley, small amounts of kale, and larger amounts of lettuces. But again, it's a smaller part of their diet. So, and that kind of, I guess, ties into calcium. There, especially a lot of vets, a lot of rescuers, a lot of rabbit people are going to say, oh my God, you must keep the calcium in the diet to a minimal level. Well, it actually is already at a pretty minimal level. And most of the bladder sludge issues are usually more relating to the rabbits being overweight or arthritic and not peeing and emptying out their bladder. Now, are there some rabbits that have a problem with calcium in their diet, and building up calcium in their body? Yes, absolutely. But I think already the amount of calcium in the diet is pretty minimal, unless they're on an alfalfa based pellet, which we use for young rabbits or sickly rabbits or rabbits that we're trying to tempt them to eat.
Wow.
You had mentioned, and forgive me, Jonathan, Rabbit Savior Jonathan he broke up a little bit. I don't know why.
Yeah.
Sorry about that. Jonathan Silva, Rabbit Savior, and Dr. Sari Kanfer. And Doc, some people have emailed about the vaccination. And
Yes.
you said some people are recommending, or Jonathan, you said, Doc, I'm sorry. Some people are saying don't get it.
Don't vaccine.
Yeah, that's outrageous, isn't it?
Yeah, absolutely. They need to be vaccinated. It is a deadly disease. It only takes a very few virus particles for a rabbit to get infected, and infection is almost always lethal, and they almost always die. So, and the vaccine is very safe. It's not like this virus is not something where you can just wash your hands and it's off your hands. I mean, it's insidious. If you walk, if you have a cottontail rabbit that was infected that ran across your driveway, and you walked across your driveway, or you walked your dog, or your cat goes outside and they went anywhere near where that cottontail was, you could bring that into your rabbit that's indoors only. We also theorize about flies and fleas. What if a fly landed on a sick rabbit and then got into your house and landed on something, and it just took a few virus
I never thought about that. Wow.
Yeah. There are many reports of rabbits who are 100% indoors, and the owners are super careful, changing their shoes when they come in the house, and the rabbits still get sick and die. It's a small percentage, but it is still a possibility.
But that's without the vaccine, though, right?
What was that?
That's without the vaccine, though, right?
Correct. That's unvaccinated rabbits.
Okay.
And the virus has spread. It started in New Mexico and Arizona. It spread over to California, and then it moved north and east, and now it's heading towards the East Coast. And so it was slowed down because of COVID. Actually, it would have been much worse if things were, if they hadn't been quarantined, people hadn't been quarantined. So it's a deadly virus. The vaccine is very effective. We were using an imported one from Europe. Now the veterinary community has one that's being made in the US. And this virus is not going away. It is always going to be in the wild population. There's always going to be a risk forever and ever. So you're going to see that, just like dogs and cats have to get their vaccines every year or a couple of years, rabbits are going to need to be vaccinated going forward.
Now, why are they not telling you to get the vaccine? That doesn't make any sense. Are these people just not understanding, or are they just...
Correct.
Got it.
Yeah, they're just not understanding, or they think the risk is minimal. I don't know why there's one or two vets and rescuers that say don't get the vaccine.
Well, yeah, I hadn't heard that. That's outrageous.
It is. The
irresponsible. I'm sorry. Go ahead.
Yeah. Yep. It's very safe.
Jonathan?
I'm just blown away. I can't believe people are telling them not to get vaccinated. I just don't even know what to say to that.
I've got another question about life. Yeah, people, the misinformation, disinformation.
Yeah,
I don't know.
but that's the world we live in.
It's very hard. And again, with people looking things up, you know, going to whatever, DuckDuckGo or Google or whatever, there's a lot of information out there. You've really got to make sure that the source of the information is knowledgeable and experienced, like yourself.
Yep, exactly. Yep. Who's saying it? Is it just somebody who happens to be a rabbit owner or a rabbit breeder, or is it, you know, somebody who's, you know, involved, you know, a member of or active member with House Rabbit Society for years, and, you know, or a veterinarian who's been treating rabbits for years. So
wow. That information can be really dangerous. Elderly rabbits, what lifespan? Again, the ones we've had have all been rescues. So it's some of them we knew the age because people had them, you know, for a year or whatever, and realized rabbit wasn't for them for a variety of reasons. And I'm not going to belabor that, but what would you say lifespan
for spayed and neutered, well cared for rabbits? They usually live 11 to 15 years.
Wow. Okay.
Yep. We've seen a few up to 15. I've seen a lot more like 12, 13, 14 years. When I first started, you know, 22 years ago, there was like 9 to 10, you know, so even just in the past, you know, 20 years, the lifespan has increased. Now, again, that's for spayed and neutered. You can have unneutered males that can still live a very long life, but some of them will develop testicular tumors later in life. For females, it's almost all of them are going to get cancer if they're not spayed. And so the lifespan in an intact female is usually about 3 to 6 years. Occasionally they can make it to 9, but then they usually have cancer in their chest. It's very rare where we have a rabbit that's, you know, 10 years, not spayed, and no disease. Yeah. Very rare.
Because we had a rabbit that we were told too old to get spayed, and she died. But she was a wonderful rabbit. They're all wonderful, right? I mean, they're all, you know, who is my favorite? They're all my favorites. Whichever ones, you know, I've had have been favorites. But we're told that she was too old to, and then died maybe a year or two later from cancer. It was sad, because had she been properly cared for when she was younger, we would have had her, and she would have had a life for a lot longer.
Yeah.
So what is that accurate that they can get to it? Obviously, you can get to a certain age where it's risky, but what would you say?
It depends. We've had rabbits who are 4, 5, 6, 7, 8, and they already have cancer that you can feel in their uterus. And as long as it hasn't spread to the chest yet and they're otherwise strong and healthy, we can spay them, and they still have a pretty good chance of survival and not having the cancer spread. But again, it does need to be done by an experienced veterinarian. Have we had some of those that don't do well? Yes, there's definitely a higher risk, but we've spayed, 8, 9, 10-year-old rabbits. So if we need to, but it is just a little bit of a higher risk because maybe it already has spread.
Gotcha. I got a question for you. What age is elderly? Is that 5 years old, 6 years old? How do you gauge that?
So I used to say 7, and now I'm saying more 8 in rabbits. What happens is by age 8, sometimes we start to see some early diseases, old age diseases. We'll see some kidney issues, heart issues, arthritis, sometimes cancers. And so, in dogs and cats, they say like senior at 7. So in rabbits, I say senior at 8. Okay. And that I do strongly recommend when they get to that age to start doing annual blood work and x-rays. And people are like, oh, well, why? Why would I want to know? Because if we find something early before it gets really bad, like heart disease, if you catch it early, you put them on heart medications, their heart is going to stay healthier longer. And it's going to be able to, the disease is not going to progress as fast if you catch it early. And also, if you find a tumor in the chest, then it gives, you can either decide to deal with it or to know, okay, we're just going to do palliative care and keep them comfortable for as long as they have left. but at least then you know what's going on.
Yeah.
So we do recommend annual blood work and x-rays with rabbits 8 years and up. And we definitely, find things. I have had a few cases where even at age 5, we found kidney stones in a rabbit, and I had one rabbit, she came in, I think she was 3. And just for a routine wellness exam, and something sounded abnormal in her chest, and we took x-rays and she had cancer. So things can certainly happen in younger rabbits, but definitely I see a lot higher percentage, 8 years and up.
Dr. Kanfer, go ahead, Jonathan.
No, go ahead.
When you say that, as humans, earliest detection, best possible outcome doesn't mean cure, but the earlier you know, and I know it's like Louie, of course, but the earlier you know, the better you can deal with it.
So you're off, yeah.
And the easier, correct?
Absolutely. Yes. And I think, and that's something that I do see lacking in some of the other vets who are seeing some rabbits, is that they're not recommending geriatric workups. So, I think it's so important, especially you've got a 12, 13-year-old bunny, stuff's going on. Let's take a look. Let's see how we need to support them. Are they starting to get heart disease? Are they starting to have kidney insufficiency? Should they be on, special meds or sub-Q fluids, things like that? So, I think that, we like to give them the equivalent care to, a highly cared for dog, cat, or human.
Yeah.
When again, thinking about that, it just, I'm as the elderly one here, well into my senior years, seriously, I mean, when I went to a GP not too long ago and said, you need to have this blood work and this, I said, I don't need all that. Doc, come on, I don't need all this. She said, I'm insisting because your age. Yeah, okay, exercise, eat a healthy diet, whatever. There are age, and people will say this to me, oh, you're as young as you feel, or when I turned 60, almost 10 years ago, people will say 60 is the new 40. Well, there are realities with age, correct? And like in rabbits, you've got to get those tests more frequently than they would need if they were younger.
Yes.
Yeah, sometimes we even do it every 6 months, especially as they get older and more frail. And, if you don't look, you're not going to find it. Just because the exam looks okay doesn't necessarily mean your rabbit is 100% healthy. They're famous for hiding things. So that's why any rabbit that shows any signs of illness, it's like, we need more information. We need to do blood work and x-rays. So, one of the common comment I hear from clients sometimes is, my rabbit was fine before it came to see the vet. It's because we found all the things you didn't know were going on.
Are they serious?
Sometimes, sadly, they come in for, a broken toe, and we find like 3 other things going on. A good vet.
Dr. Kanfer, they actually say that? They actually say, are they serious? Yeah. I could see someone saying that, if I was, I'll use myself as an example. If I was diagnosed with something and I'd say, well, I was fine before I went to the doctor. That's like, they can't be serious. Are they? Please tell me.
I've heard it as sometimes joking, but I've had people who, actually, who don't understand pet care, who don't, pet medicine, and who don't understand what the veterinarian has to offer. Maybe less experienced people who are having trouble affording things. And, they brought in an animal that they thought was healthy. And here you are telling them, no, your animal has all these issues, and this is what it's going to cost. And they're just, in disbelief. And so yeah, I've had that comment several times over the years.
And again, that's why, and I know we all agree here, that's why you have to be educated first. I think anything, even in having a child, educate yourself first, not after.
Yes, a rabbit is not a first-time pet, period.
Yeah. No.
We all agree.
We talk people out of getting rabbits. Even our staff, most of our staff are not rabbit owners because they know better. They know how much it takes to take good care of a rabbit.
It takes a lot.
So a lot of times, we've had staff members before that are rabbit owners, but you really just need to really be committed, to really do a good job. And, and that's the other thing is rabbits in classrooms. Ooh,
nope.
That just, that's, The only time, that
awful.
doesn't go well. I think pets in general in the classroom don't go well. unless it's, say, the teacher, it's her personal pet,
Yeah.
and she brings it in.
Yes, for show and tell.
time in the
whatever.
classroom,
Yes.
but then it goes home with her on weekends. But otherwise, if you get a classroom
That's
pet,
awful.
they extremely rare for them to get proper care, proper husbandry. And then what ends up happening is you're what's the story? What's the education for the students? The education is that, you know, you're just winging it on how to take care of them, and whenever it needs medical care, you can't afford it, and then it dies.
Yep.
So that's what you're
cruel.
teaching the students, and it's just not a proper thing to teach.
No,
So,
not at all.
and it's
No.
just, you know, and it's causing these animals to suffer.
I by the way, I've heard many times, even area rescues have told me you try to talk people out of getting to me. You know, I do because you don't realize the cost. You've got to be able to afford them. I know we've had the same issue where you want to take another one in, yet you've got to have the economics. You know, even though you have the knowledge, and we had a lot of experience at the time. I think we had 6 rabbits at that time. I don't know, maybe more, but I believe 6 was probably the most we ever had at one time. You want to, but if you can't, you're not helping the rabbit.
No.
If you can't,
You're hurting.
have the economics.
Yeah.
For feeding them and the produce or whatever, and the vet bills.
Yes. And rabbits do best as indoor house pets. So some people are still thinking they should live outside like livestock, but they should be kept more like your dog or your cat. And even, you know, there's people who talk about free roam rabbits.
Mine are
And
free roam.
I think that certainly that is ideal, especially if you only have, you know, like a couple of rabbits, 2 rabbits, they can be free roam in the house. When you have multiple rabbits, sometimes it's like this pair is in this room, this pair is in that room.
You have to have the baby gates, right? The baby gates.
But then, and then also I think, you know, sometimes what's a good way to do it is when you're not home or when you're sleeping, you have them in a pen, in a large X pen, so that they still have a very good big area to be in, but then you keeping them from being naughty when you're not there to observe them. And then but then they still need exercise on a regular basis. And there's people who just keep them primarily in a cage, and they never get to come out, or they'd only come out briefly. And so I think that, you know, changing that thinking, it definitely is improved since you know, over the years, but I think there's still people who still, you know, pretty much primarily keep them in a cage or in a hutch outdoors. Now, there are people who have them as outdoor pets, or they have a converted garage. And certainly if you can't physically have them in the house for what, you know, maybe your family or somebody's got severe allergies, then at least if it's you're protecting them from heat, you're protecting them from predators, that's fine. But certainly I think what then is hard to do is monitoring them, because when they're an indoor house pet, they're a family member, you're feeding them morning, evening, you know that they go right up to that food right away, you know how much they eat, you know if their behavior is off at all, you know right away if they're sick when they're an indoor house pet family member. If they're outdoors, whether it's in a converted garage or in a hutch or free roam in the yard, you don't know how much are they eating, when do they get sick. And so by the time you realize they're sick, they're even worse. And the longer you wait, the sicker they are, and the more expensive it gets to save their life. So now there are people who can still do a decent job outdoors, and that kind of goes back to the, you know, there's more than one way to skin a cat. I mean, there's people who take great care of their rabbits that have a converted garage and spend a lot of time with them. They've got a huge area to roam around in, lots of toys, and that's totally fine. It just, you know, can be more challenging because they're not in your space, you know, all the time. And so, but just to be aware of that. And there are just people who don't take as good care of them when they're outdoors. So that's just something to consider, to focus on.
I just wonder why would you get a family? I mean, they're family members. Why would you get a rabbit to put it in a cage outside or even, and I would worry about hawks. I would worry about, even if you're fenced in, I would worry about, and why do you have them? I understand if you want to go outside with your rabbit for a little bit, if you have the right area and you're watching, I'm always would be concerned about hawks, right? But why would you get a rabbit that you would want to put in a hutch or in a garage?
Well, some people don't know. And
they do not know.
They at the pet store, or, you know, you know, and they see a rabbit, or their friend has rabbits with babies and they get a rabbit from their friend and they just don't know, and they don't do the research, or they don't do the correct research. And they just think, oh yeah, well, my friend had it outdoors, I'll just have it outdoors in a hutch. Or they find the rabbit and they physically can't have it, as, you know, they're just like, well, I can't get rid of this rabbit. I can't find a home for it. So I guess I just have to keep it. And they just are kind of doing the best that they can, or they get it as a gift for their child. And it's, you know, and then it's just, you know, they're doing the bare minimum to take care of it because they don't have a personal relationship with it. It's just like, oh, my kid wants a rabbit, or my kid wants a guinea pig. And it's just, you know, they throw food and water at it, and they rely upon the, you know, behavioral and environmental enrichment for the child. So yeah, there's a lot of different reasons why, you know, somebody might have that. I mean, for 7 rabbits, do you think I get to cuddle every one of them every night?
You want to, though. I'll bet you want to.
Yeah.
Right.
I mean, I have one of my pairs and their brother, sister, and they're very happy bunnies, and they basically have a room to themselves. They have a lot of toys. You know, I can reach over and pet their heads, but, you know, they don't want to be petted more than that. You know, if I go and I sit with them, they just, you know, nah, forget you. So yeah, there are certainly bunnies that, you know, don't need to do that. But in general, I think just the key thing is just being able to take good care of them.
Now, on top of that topic, what's your take on these people dressing up their bunnies? They got collars like a dog. What's your take on that? Because I see it on Instagram. I cringe personally, but I want your opinion.
Well, I think there's 2 kind of different things. When it comes to the collars, we are very concerned about the health risks because there have even been cats that have gotten strangled by their collars. And so there are breakaway collars that, you know, so if a cat has the breakaway collar and it gets caught on something, at least it can break off and not strangle them. But for a rabbit, their spine is a little bit more delicate, and things can stress them out so much that they start to freak out and struggle. So if they get their neck caught on something, they could break their neck much more easily than a cat would. So that's our biggest concern. You know, certainly you do always, anytime any animal wearing a collar, you always have to be careful of the size of it. And, you know, is it going to be too loose and it's coming off? Is it too tight and then it's constricting? So in general, I think majority of rabbit savvy people cringe when we see a rabbit with a collar, and we strongly recommend not having a collar on. It's a big safety issue, and there's no need for it.
There is no need. I mean, I look at these people online and I'm just like, what are you doing? But they think it's cute because they want the likes, they want this, they want to be, you know, famous. But.
And the reason why dogs and cats have collars is for identification purposes, and also for a dog, you're controlling it when you're walking it, so that it's not going to run off, or, you know, so really there's no reason for a collar on a rabbit. Now, in terms of dressing them up, you know, if you did it occasionally, briefly, you know, oh, let's take a couple cute pictures and then take it off, I think that's okay, as long as the rabbit is not stressing out about it and not freaking out. But in general, I mean, to have it wear them on a regular basis, I think is unnecessary, excessive. I think the key thing is you still have to remember it's a rabbit.
The rabbit.
I'm not saying that is like, oh, it's just an animal. No.
I know.
Understand what's natural for it and what's not natural. And to be honest, carrying a rabbit, not natural for it. Now, there are rabbits who get accustomed to it and they're fine with it. But a lot of rabbits don't want to be held. And so instead you sit on the floor and let them come up to you and you cuddle with them that way. So it's not a natural thing for a rabbit to be picked up. It's very scary. They feel like they're being carried off by a hawk.
Correct.
So, you know, so I think still, by and large, you still have to think of what's natural for them. Like a lot of people, they look at hay and they're like, oh, what a sad diet. It's so boring, hay and pellets. But in what we have to think of what's natural, what's, you know, for the rabbit, what they require. And in the wild, they're going to be living on grasses and dried grass and branches and leaves and really coarse stuff. That's how their stomach, their intestinal tract, and their teeth have evolved to handle those diets. So we might think like, oh, we're giving them all the fruits and the vegetables and lots of carrots because I want them to have treats and feel loved, but and have them beg for it. But in reality, then we're leading to dental overgrowth, we're leading to GI upset, obesity, things like that. So we still have to do the best for them, their mental state as well as their physical state.
Now, you said something about the stress. Now, I see these people, the strollers, are putting the strollers, carrying them in backpacks. That's not good for the rabbit, right?
I think, again, it's key that you're being careful because they can get overheated. They can get stressed. If you're doing it once in a while, it's probably a lot of stress. If you're doing it on a regular basis, the rabbit is probably going to get accustomed to it. There are some rabbits that are very bomb-proof, gregarious, curious, and that's totally fine. I think just the key thing is understanding your rabbit's personality and being very careful when you do it. Some people will have their rabbits on a harness and take them to the park. My concern is your rabbit is still a prey species. A dog suddenly lunge at the rabbit and the rabbit freaks out. And then either it runs away and the leash is trailing after them, or they've ran to the end of the leash and now they're injured, they're back. So you have to be careful of that. So certainly if you're taking them into a controlled environment, you're being careful that they're not getting overheated, they're comfortable in the carrier, and then also considering their feeding. They need to eat almost constantly when they're awake. And so if you have your rabbit and you're visiting somebody and they're in the carrier or in the stroller for 5 hours, they're not eating, they're not drinking, they're getting dehydrated, their gut's not moving. So you're affecting them that way. So just to really be considering that stuff. I'm not saying don't bring your rabbits out in a stroller or don't carry them, but just to
follow protocol.
Be aware of it, be aware of what your rabbit needs are, and just to always try to do it in a safe manner for the rabbit.
Well, that's great advice, Dr. Kanfer. You were talking earlier about twisted liver.
Mm-hmm.
What can you explain?
What is that? Explain that.
Yeah, I don't think I've ever.
So, and it's something that if you don't look, you're not going to find it. And it's sadly, it's more common than we think. The three most common things we see rabbits, come in for that are not eating are either just a minor stasis, a bloat where there's a little chunk of hair stuck in their intestine, or liver lobe torsion. Those are kind of the three most common things that we're seeing for a young, middle-aged, healthy rabbit that they just suddenly stop eating. And so what happens, and we don't know why the liver lobe twists. They have 5 lobes to their liver, and the one that most frequently twists is on the right side. And it just twists, and we don't know why. What'll happen is the rabbit usually just stops eating, lethargic, maybe a lot of abdominal pain. Sometimes what happens is that because of the twist, it actually causes bleeding into the belly, or it can affect the clotting. And so then they can't clot. And so what'll happen is the rabbit can actually get very anemic and lose a lot of blood into their belly. And you don't know unless you do x-rays and blood work. For the vets that are in the know, basically your classic signs on blood work is elevated liver values, and usually paired with low red blood cells, anemia. And so those are the classic signs. Now, some of these rabbits need emergency surgery to save their life. Some of them can be treated medically. It depends on how bad they are, how are they eating anything, how bad the anemia is. If they're not that anemic, potentially they could be treated medically, but it is serious and it is very life-threatening. And it's something that maybe not a lot of people know about, but if you look, you'll find it.
Yeah. And again, if you look for it, if you have it tested, like you were saying, if you go along with an experienced exotic vet, someone who's experienced with rabbits that knows what to look for and do those tests.
Yeah.
And that's really important. Like, again, the early diagnosis you were saying earlier also, and again, people that don't have a lot of experience with rabbits, that they hide. Again, they're prey animal. So if they're, staying under the bed and not coming, will you tell us, Doc?
Yeah. Oh, absolutely. I mean, you should feed your rabbits at least twice a day meals where you put a certain amount down and that they're going to run up and eat it right away. If they don't get up to eat like they normally do, very concerning. If they run up and look at the food, and turn away, very concerning. If they're not finishing it all, also concerning. So if your rabbit stops eating, you know, in dogs and cats, I'll wait a day or two until I call the vet. For a rabbit, you wait maybe an hour or two. And if they're not taking treats, they're not eating, the best thing is to get your rabbit seen as soon as possible, within a couple hours of stopping eating, because the faster we can get treatments going, the better it is, and the faster that they're going to respond. Sometimes it's really minor. We do exam, maybe some x-rays, everything looks really good, blood work looks fine, and then we just give like some fluids under the skin, some pain meds, and some intestinal stimulants, and they can go home. And then it's a few $100s, maybe, you know, $1,000, depending on what part of the country you live in, and if you're in a big city. If it turns out to be a bloated rabbit, you could be looking at $2,000 to $5,000, you know, or liver load torsion. And that kind of goes with, you know, be prepared for emergencies. Because, you know, I mean, any animal owner really needs to be prepared. You know, there's, you either have a fund available to, you know, for me, I have, you know, a certain amount of money just pulled out of every paycheck, goes straight into a savings account. There is pet insurance, but you still have to put the money down first, and then you'll get reimbursed for part of it. Sometimes if it's a pre-existing condition, then they're not going to want to cover it. So if you go to the vet and they find dental disease, you can't just go and get insurance at that point. Nope. Now, and insurance, when you are, there's, I think, only 1 or 2 companies that will cover rabbits. And, you know, it's pretty inexpensive when you're first, you know, when you're getting a young, healthy bunny, and it is going to help. I mean, it may not cover all the costs, but it's going to cover a decent amount. And it's, you know, certainly something is better than nothing. Correct. There's also a lot of vets will have a payment assistant, which is basically like a credit card for your pet, either Care Credit or Scratch Pay. But sometimes if you have your own credit card, then you pretty much are always going to be accepted for Care Credit or Scratch Pay. If you don't have a credit card, then it's much harder to get credit. Right. And vets can't afford to be a credit company. They can't afford to do that. We have to pay our staff. We have to pay our doctors. We have to buy the equipment. And so we just can't afford to be creditors. And to do discounting. So, and
that's what people don't realize. They're like, oh my gosh, it's so expensive, but the rabbit is not cheap, period.
Right. And I mean, and you know, and certainly, you know, even dog and cat care, it depends on what's wrong with it, how sick it is, and what needs to be done. And, you know, in terms of like a spay or a neuter, they've discounted those for dogs and cats for ages, just because they need to keep the population down. Yeah. But in general, a spay is a challenging, invasive surgery that takes a lot of skill, whether it's dog, cat, rabbit, you know, or other species. It does. And so, you know, certainly, you know, as I said, it's just that people are used to those discounted rates. And so, but if you have a cat who is blocked and can't pee, that's going to get expensive. You know, if you have a dog that breaks its leg, it's going to get expensive. And then so it's the same high quality of medicine that we're doing in dogs and cats and rabbits, you know, as humans. And so it's the same stuff. It's actually, we're actually more experienced because we're doing this on rabbits, and, you know, a lot of people don't have that knowledge. And so, so yeah, things cost money. And I think also what people don't realize, because when you're going for your own health care, you don't see the bills. No, the insurance covers most of it. And what happens is that you don't realize that you're already paying through your salary every month, what, $150, $250, $300 taken out of your paycheck. So you don't realize what you've already been spending on your insurance company, and that then they're going to cover it. So when you go to your doctor and you know, for whatever reason, you're not charged a lot of money. And so then you just don't expect to see all these bills, and you just think of how expensive it is.
That's all it is. Exactly.
Yep. But yeah, the insurance companies got it really nice because they really divorced their payments from, you know, from the actual medical services.
Right. Yeah.
Jonathan, a little bit about rabbitsavior.com.
I got one more question though.
Go ahead.
On the vaccine, have you had any side effects or known side effects that actually have been reported?
So we've had some rabbits who are breathing faster for a little while, like an hour or something. Maybe have a mild fever for a day or two, decreased appetite for a day or 2 or 3. We've had some who've been sore in their front leg because we give the vaccine near the right shoulder.
Okay.
But other than that, we did have one older, pretty arthritic rabbit that her arthritis significantly worsened again, because I think her right front leg just kind of was a lot weaker after this vaccine. And so it just made things a lot worse for her. But overall, those are the only signs that we've seen.
Wow. Okay. What about the first vaccine? It was last year, right? That was from overseas, from my understanding.
Yes, that's the same signs with the European vaccines as with the Medgene.
Gotcha. Okay. Always wondered that.
Mm-hmm.
Jonathan, a little bit about what you're doing with Rabbit Savior.
Yeah, well, Rabbit
You're doing
Savior is the
wonderful.
rabbit advocacy platform. We offer vet bill assistance, like we were talking about. We have the Fund My Bun donation platform. We have the educational stuff. We just teamed up with Oxbow to do the educational part of it. So we're growing. We're trying to help as much as we can, and that's what we're here for. It's going
It's
good.
rabbitsavior.com, rabbitsavior.com. Dr. Sari Kanfer, you are absolutely wonderful and great information.
Yes.
With your experience, and it's just, I'm blown away. I'm blown away.
Thank you.
Yeah. We
Thank
want to
you.
thank you so much for having me on the show. I know there's a lot of listeners and viewers right now like, oh my gosh, this is amazing. So
Yeah.
thank you so much.
A lot of information with your experience. It's fantastic.
Thank you.
Maybe
Thank you.
somebody out there will pay off your education bill. Wouldn't that be
Well,
nice?
right now we're thinking of getting a CT scanner for the hospital. So, because we've been doing a lot of CTs lately.
Wow.
So,
Can we take a minute? Can you tell us a little bit about the CT scan?
sure. Yeah, we currently refer out to a couple of local places for CT scans. They're really super helpful when you've got a rabbit with a jaw abscess in the upper part of the jaw, especially, or if they have a chronic nasal discharge and breathing issues. There was one case where the rabbit just wasn't eating, and we did blood work and x-rays, and we couldn't figure out what was going on. So we sent it for a full body CT scan to locate the problem. It turned out it had an inner ear abscess.
Wow.
Yeah.
Wow.
So the CTs they're definitely more and more affordable these days, and you can just see so much more detail than you can on an X-ray.
And do you mind if I ask, you're planning on getting one? Do you mind
We're
if I ask
looking
what they, can you give us an idea of what something like that would cost?
About $350,000.
Wow.
There you go, people.
See, that's there. Yeah.
There you go.
Jonathan, that's what I'm thinking. I mean, you wonder why. And it's because you can give such good care with them.
Yeah.
$350,000 for that equipment.
Yeah. When I'm doing my jaw abscess surgeries and my rhinotomy, my nasal surgeries, I absolutely need a CT scan in order to be able to plan my surgeries and to see where the problem is. Otherwise, I would not have,
Going into
success
blind.
with- Yeah. The X-rays just don't show you enough detail in that area.
That's fantastic.
Wow.
You're great.
Great.
Thank you, Dr.
Thank you
Sari
so
Kanfer,
much.
so much. My friend Jonathan Silva,
We'll see you guys later. Till next time.
rabbitsavior.com.
Love it.
Thank
Bye,
you.
guys.
Thank
Thanks.
you.
Doc,
Bye.
thanks.
you.
Thanks.
All right.
Thank you so much. Fantastic information, ladies and gentlemen.